Your skeleton is on a countdown. After the age of 30, you lose up to 1% of your bone mass every year. That a silent fracture setup unless you act today. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the bone loss that happens after the age of 30 and how you can slow down this process and also fix your bones so that your risk of getting fractures decreases. So why is that the turning point in your bone health? The peak bone mass hits allowed the ages between 25 and 30. So your bones have built to their highest level at this age. Then from the age of 30 onwards, bone resorption and formation balance where you have more net loss than now the formation. So your bone mass starts now to decrease because resorption is more than the formation. By the age of 50 years, many lose 10 to 15%, between 10 to 15% of their bone density. And this is the time you start saying hello to fractures. You are more prone to get fractures. So what are some of the risk factors that are speeding your bone loss? Smoking and the excess alcohol use. Smoking affects your blood supply to your bones, and this makes your bone formation more difficult. So if you decrease your bone blood supply, then you are also decreasing the strength of your bones. And this also happens if you are also using excess alcohol. If you are using sugary foods, because this make it difficult for calcium to reach your bones, and so the strength of your bones is affected because they have less calcium. So if you want to build strong bones, stop taking sugar and stop taking refined foods, and they rely more on whole grain diets. Then a sedentary lifestyle. If you are moving very little, then you do not use your bones as much as possible. If you park your car in a yard, that car wears away than a car that is moving. And that is the same thing with our bones. If we are not using them, then we lose them. Remember, this daily movement helps the bones to restructure themselves and build their strength. They absorb more calcium, they absorb more phosphorus, and so they become more strong. So if you want really to maintain your bone health, move more. So low calcium and vitamin D diet. Yeah, some of the things that we do, like taking tea, taking coffee, they affect our calcium absorption. And so if you take less calcium and vitamin D, we do not have adequate time for sun exposure, then you risk your bone becomes more fragile. So if you want to build your bone strong, risk to be more strong, then reduce the amount of coffee that you take and have more time for sun exposure. Then long-term use of steroids. If you are using drugs like prednisone, dexamethasone, and especially if they are not prescribed by a doctor, then you risk losing your bones and you destroy your bone health. And this also happens if you do not have adequate sun exposure. If you expose your body to adequate sunlight, then you help your body to build more vitamin D, and this helps to build your bones. So that 10 minutes walk when you are taking a break just to catch up with vitamin D is very vital for your bones. So some of the early signs that you might miss that your bones are wearing away would be receding gums. This is because of the jawbone loss. Then you have a weaker grip strength when you hold things. you don't have the energy as you used to have. Then posture changes, you start stooping, you are not walking as upright as you should, and then having frequent muscle cramps or leg pain. So how can you fix your bone nutrition diet? One, ensure that you have 1,000 to 12,000 milligrams of calcium on a daily basis. How do you make sure that you have adequate calcium supply, eating daily products, and also fortified plant meal? Then 800 to 2,000 international units of vitamin D. How do you get adequate supply of vitamin D? Adequate exposure to sunlight for adequate amount, but also avoiding overexposure to sunlight, because remember that overexposure to sunlight can also put you at risk of getting skin cancers. Then having adequate supplies of omega-3, which you can get from fatty fish like salmon, and also getting adequate supplies of green leafy vegetables, and taking olive oil. Then reducing salt and sugar intake. This increase your calcium loss, and also they reduce your supply of calcium to your bones, thus weakening your bones. So you need to take less sugar as you age. Then strength training to build your bone. This helps you having resistance exercises helps to load your bone, and this helps your osteoblasts to build more bones because you stimulate them so that they have more of the calcium and vitamin D. So you stimulate them to build more bone. Aim for 2 to 3 sessions of resistance training session on a daily basis. These include things like squats, push-ups, and jumping jacks, and also things like skipping ropes. Add impact like brisk walking, rope jumping, and even light jogging. This will help you build your bones. So, what are some of the lifestyle hacks that you can use to build your bone density? Limit your caffeine intake to less than 300 milligrams on a daily basis. If you are a smoker, work to quit smoking. Nicotine chokes bone blood supply. Take alcohol in moderation. For a man, less than 2 drinks. For ladies, less than 1 drink. Prioritize sleep, 7 to 8 hours of sleep. Increases your growth hormone levels and helps your bone growth at night. So let's join this 30-day challenge to boost our bones. For 3 times per week, do strength training. For every on a daily basis, ensure that you are taking adequate calcium and also vitamin D, and then have 10 minutes sunshine breaks to build your vitamin D3 levels. Post your progress so that we build strong bones. So your future to get fracture depend on what you do today. So drop a message if you start building your bones by strength training. Tag a friend over 30. It might save their backbone and help them to age gracefully. So for more tips on building healthy behaviors, follow the Overall Health Life YouTube channel. Thank you.